Hi, my name is Robert Shelley, and I'm an attorney with Shelley Law, and my law firm assists physician residents in negotiating their first employment agreement. Today, I'm going to talk about a topic that many people are interested in moving into residency, and that is, can I be fired from a medical residency? And the short answer is yes, you absolutely can. As you transition from medical school into internship into residency, any residency program is going to have a code of conduct, policies and procedures, and then the med staff and hospital or network where you're working will have similar things, which kind of dictates how the program can remove a resident from training. And most people wonder, well, what could I do to get fired from my medical residency? A whole bunch of things. Just because you are a professional doesn't mean you don't have problems. And many times when you are a professional, it can exacerbate problems because of, especially in medical residency, the lack of sleep, just being overwhelmed with so much new information and responsibilities. And then that kind of combination can result in, and this is the kind of the main reason why people have problems, is potential impairment due to use of drugs or alcohol. If you're an alcoholic, many times people can get through med school, no problem. But if it continues to get worse and worse, it can affect, obviously, the provision of safe patient care. And certainly if you're ever come, to work under the influence or suspect of being impaired in some way, that's going to be a huge problem for the resident. But the good thing is most programs are willing to work with a resident who have some type of impairment issues. And there can be a break. So maybe they could go to treatment or like residential treatment or an IOP, which is an intensive outpatient treatment program. Start going to like a 12-step group, get things under control, maybe random drug testing. And maybe after that period of time, once they're sober and good to go, the program will allow them to come back and finish training. For someone who's unwilling to do any of those things, a lot of people are in denial when they have impairment issues, and they may say, no, I don't need any of those things. And then that could lead to a program removing or firing a resident because of that. So that's the first way someone can be removed from a program, is impairment due to drugs or alcohol. The second would be clinical problems. And actually, this is a pretty small percentage of like a main reason why someone would be removed from a program. But if someone is having difficulty grasping concepts, just can't seem to get it for whatever reason, usually there's something else beyond then not having the mental capacity to do it. But if there are continued clinical problems, normally the program would put the resident in some kind of corrective action plan or some kind of coaching program, something like that, which would then assist them in getting up to speed. And then if the clinical problems continued after that remediation, that would be grounds for removing them from the program. Mental health is another reason someone can be removed from a program. That normally leads to some kind of behavioral concerns or problems. Just can't get along with your other residents or the attendings or some of the physicians in the hospital or staff, or you just have maybe terrible bedside manner due to some untreated mental health issue. That also can lead to the removal from the program. Dishonesty. So if you get caught cheating or something like that, obviously can be an easy way of getting removed from a program. This is also the most difficult one when dealing with a medical board. My firm represents physicians when they have issues with medical board here in Arizona. And I can tell you that the dishonesty problems with, with removal from training are the absolute hardest to overcome when applying for full licensure down the road for a couple of reasons. If you have impairment concerns, those can be remediated, go to treatment, drug testing, AA, get it under control. Same with mental health. Go to a psychiatrist, maybe get some psychotropics, go to counseling, that can be worked on. Clinical issues, just put in the work, right? Go through the extra steps needed to get your kind of clinical problems under control. If you are dishonest, there is not a lot of things that can be done that satisfy a board's concern about kind of the character of that physician. Sure, you can do ethics training, maybe some other kind of continuing education involving morals and ethics in the profession. But I can tell you that dishonesty, cheating, that type of thing is very hard to defend as a defense attorney. And that is one thing that many boards are just they're not willing to get over. They may just, I've seen people that have had problems in training or been removed from programs, and they come back, finish out another program, still have to think, all right, well, these are things you're going to have to disclose to a medical board when you're applying for licensure down the road. And this is something that they could potentially deny licensure for. So that's another issue, would be dishonesty. So impairment concerns, clinical issues, behavioral / mental health problems, and then dishonesty are kind of the four main reasons why someone would be removed from a program. I guess the last one would be inappropriate relationships. I remember having a client who was in mental health, and then they started up a relationship with someone that they had treated. And obviously that is a complete no-no. And that led to them being denied licensure down the road because they were removed from the program. So I guess I could lump that into maybe boundary violations. There are some professional responsibilities that any healthcare provider must keep in mind. And one of those is just inappropriate relationships with patients. And that's just something you absolutely cannot do. So those are the ways someone can be fired from a medical residency. It certainly can happen. Just going through the process of, all right, what if you have one of these incidents that happen? What will happen is the program will usually attempt to provide a path back for the resident, as I said before, through corrective action plans, some kind of coaching program. If they can't get it, many times the programs will make them sign what's called like a last chance agreement. And then it lays out all of the things that the resident needs to do to stay in the program. And then if they were to violate that last chance agreement, that would be it. They'd be removed from the program. But if there was some kind of removal that was going to happen, there will be an appeal process. Sometimes it's very, very short, meaning like 48 to 72 hours that could require the resident to appeal or lose those rights. And then normally what would happen is if you do appeal, then you'd go in front of some kind of committee that would then essentially determine your fate. So that's kind of the process. It certainly is difficult if you get removed from a training program because obviously you don't want to give up on becoming a practicing physician down the road. And so trying to find a new program that's going to let you in can be difficult. But as I said before, just because you're a professional doesn't mean you don't have normal problems like everybody else. All right. Well, that's a little primer on whether you can be fired from medical residency. If you have any questions about that, I'm certainly happy to answer them. You can contact my law firm at the phone number listed below in the description. There are a ton of videos on this channel about physician resident issues, and then certainly transitioning into your professional career out of training. And I would suggest that you watch some of those videos. All right. Appreciate you watching this video. Take care.